And welcome back to the show. Now, this past year, we have all been focusing on COVID, right? It seems like that's all that's been happening around the world. Well, but what about all those other viruses? We're talking about HIV today, and I want to bring in Kelsey Genovese. I just love your beautiful last name. Kelsey, thank you for being here.
Thank you for having me.
Now, you're at the University of Utah Infectious Disease. First things first, I want to ask you, how many Utahns have HIV?
So on average, around 120 Utahns are diagnosed with HIV every year.
Okay.
And that's been about the same for the last 10 years.
Okay, so it's pretty steady, but you guys have a new goal, and you want to get to zero.
We do. That is our goal. So our Getting to Zero HIV campaign, this is a group of the Utah Health Department, HIV medical providers, and community organizations. We've come together to develop some missions, and our goal is to reduce new HIV diagnoses, reduce HIV stigma, and get to zero HIV-related deaths in the state.
Okay, so let's talk about your role and what you're doing within Get to Zero.
So there are kind of 4 strategies that we have with this campaign. That's test, treat, prevention, and respond. My big focus with my role at the University of Utah is in prevention. So half my time is working in a free PrEP clinic. Okay. PrEP is pre-exposure prophylactic treatment. This is a once daily medication that when someone takes every day can prevent HIV up to 99% of the time if they were to become exposed to the infection.
Wow.
So it's very effective. A very neat breakthrough, and it's actually been around for a while, but we're just not using it the way that we need to in our communities.
Okay.
So one thing that we've done is develop this free PrEP clinic where if folks are uninsured and have a risk for HIV, they can access this clinic at the University of Utah, and that's where I spend half my time seeing patients there.
Wow, pretty amazing though that you've got this clinic for people who don't have insurance, but what about the people who do?
So if folks have insurance, then they can see their family practice provider.
Okay.
So there's been a lot of information and evidence in the last few years that's shown that PrEP should be done in the family practice setting.
Okay.
So if folks cannot find a provider, they should reach out to us, or as we'll talk about, the HIVandme.com website has a lot of providers and clinics in the state that do provide PrEP for those who have insurance.
Okay, now let's talk, I think people go, okay, how can I get HIV? How can I not get it? Let's talk about those, first let's do how can you get HIV?
So you can get HIV is a blood-borne illness. So most common is sexual transmission. It can be through needle stick, injection drug use. Those are the most common.
Okay, so we've got that up on the screen right there as well, the ways you can get from HIV. And it says breast milk in a very rare case?
Very rare cases, yes. So if someone is living with HIV and becomes pregnant, we monitor them very closely, but there can be risks depending on how high that virus is in their system.
Interesting. Okay, now let's talk about those ways you can't get it.
Yes, so you cannot get HIV from saliva, sharing utensils, hugging, kissing, public restrooms. Those are ways that you cannot get HIV.
Yeah, and I think there's sometimes some myths that go around about that I think, and even back in the day, people were a little freaked out about certain things, like public bathroom,
Right, we had a lot of stigma related to that, and that's one of our big goals, is making sure that we get rid of those myths so we really have an understanding of what transmission is from.
Oh, no, it's great that you're really trying to educate people, and give them the resources that they need, but also teach them how it can be prevented in different things. So if people are wanting more information on this, Kelsey, where can they go?
So there's a beautiful website that we made with this campaign. It's called HIVandme.com, and that has everything on it talking about prevention, ways to access PrEP, information, treatment, and ways that those who are living with HIV can access treatment. Everything is there.
Perfect. Love it. Kelsey, thank you so much for coming in, and best of luck with this campaign.
Thank you so much.
Thank you.